Start. Good afternoon, everyone. My name is Dr. Parag Dashatwar. I am a consultant gastroenterologist and liver transplant physician at Kamineni Hospital, LB Nagar. Today, I am going to talk to you about a very common problem, uh, which is called as fatty liver. So, what is fatty liver? Fatty liver means excess accumulation of fat into the liver. Liver is one of the biggest organs in the body, and normally the fat content in the liver is less than 5%. Whenever this fat exceeds that limit, then the liver is called fatty liver. Uh, what are the causes of fatty liver? Why the fat content in the liver increases? There are various causes of this happening, and there are a couple of patterns of this happening, but most common cause by and large is alcohol use. And second, equally important cause is non-alcoholic fatty liver, what we call as non-alcoholic fatty liver disease. So if we take 100 people with fatty liver, almost half of them will have alcoholic liver disease, and other half will have non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease is an umbrella term for the conditions where alcohol is not a cause of fatty liver. Uh, Most common cause of this non-alcoholic fatty liver disease is called metabolic syndrome. Metabolic syndrome is nothing but constellation of obesity, high blood pressure, excess cholesterol, and insulin resistance. So, whenever somebody who has diabetes, high blood pressure, and there is an ultrasound report showing that he has fatty liver and he does not drink alcohol, more often than not, it is because of non-alcoholic fatty liver disease. So, why we are talking about fatty liver at all? Why is it important? Uh, all of you have heard about fatty liver. That means that this disease is very prevalent in the society. So if someone goes for a general health checkup, uh, out of 100 people, around 30 to 40% people will have a diagnosis of fatty liver. Fatty liver, although very common, can in certain situation cause to progressive liver damage and liver failure, liver cancer, and may even need liver transplantation. So this is not exactly a benign disease which can be ignored. In subset of patients, fatty liver will progress and cause host of complications. Not only that, fatty liver itself is a surrogate marker for advanced metabolic syndrome, and it indicates that you are at high risk of developing cardiovascular disease such as diabetes, high blood pressure, heart blocks, heart attacks, and even strokes. So now we have understood why fatty liver is important. Just I will give you a few statistics. In India, in urban areas, in an unselected population, that is at random, if suppose somebody is getting an ultrasound scan, uh, out of 100, up to 40% people will have fatty liver disease. So the magnitude of problem is huge. And because although the minority will develop complication, because the absolute numbers are so huge, going forward in future there will be a lot of patients who will have advanced liver disease because of fatty liver disease. uh, when somebody develops advanced liver disease, they will develop what is called as liver failure. Liver failure usually manifests as jaundice, accumulation of fluid in the stomach, leg swellings, vomiting blood or dark colored stools, altered mental status, and hepatocellular carcinoma. So when somebody has progressed to such level, it is usually too late to reverse the changes. And if at this stage, if you want to cure the disease, there are currently no curative options. With medication, we can only control the symptoms. But if we are looking at a curative treatment, liver transplantation is the only way out. And as you can understand, liver transplantation is neither easy nor affordable and not entirely risk-free strategy. So that is why it is very important to understand who is at the risk of developing fatty liver. Once you are diagnosed with fatty liver, what to do and what precautions to do and what are the warning signs of advanced liver disease. So I'll briefly touch upon all these questions going forward into this discussion. So what are the symptoms of fatty liver disease? Unfortunately, there are no specific symptoms of fatty liver disease. You will not know that you have fatty liver unless you get it checked. Sometimes, in certain rare cases, if the fatty liver has developed too rapidly, it may cause some dull discomfort into the right upper side of your belly. That is one thing. But more often than not, you will be diagnosed only based on the tests. Sometimes some people may develop generalized weakness, low appetite, and these things usually indicate advanced liver disease. So in our focus is to catch the people when they have not developed any complications of the fatty liver. So that is why it is very important to understand in initial stage of fatty liver disease you will not have any symptoms. Why is so? Why somebody who has a fatty liver, why doesn't he have symptoms of liver disease? It is because liver is an organ which has a tremendous regenerative capacity. So however injury or insult you do to your liver, it regenerates, it reproduces itself back to the normalcy. Patients who have fatty liver disease, they have repeated insults and injury to their liver, and one stage reaches in certain patient that they can no longer regenerate, their regeneration capacity is over, and that is when the liver failure signs and symptoms start. So it is important to understand that fatty liver disease is mostly asymptomatic, and until you test it, you will not know that you have fatty liver disease. uh, Out of 100 people who have fatty liver disease, around 15 to 20% of patients will progress to develop advanced chronic liver disease or liver failure or liver cancer. So identifying who is exactly at higher risk of developing this complication is also an important thing. So how do we diagnose fatty liver disease and how do we risk stratify whom to follow, whom to uh, loosely follow, whom to strictly follow? Because every fatty liver, I think, now in this day and age will require a follow-up once diagnosed. So fatty liver is diagnosed based on imaging. Basically, any kind of scan that you do for your abdomen can pick up whether the liver is fatty or not. Most commonly, this is ultrasound scan of your abdomen, likely done for any other cause like abdominal pain or kidney stones or any other issue. Sometimes they are incidentally shown to have fatty liver, or it is usually picked up in health checkup packages where you do ultrasound as a routine and you see there is a fatty liver. So typically a report may say that increased echo texture. They may even give you a grading of fatty liver, grade 1, 2 or 3. So grade 1 fatty liver is about 30% of the liver is fatty. So normal liver fat is around 5%. Once it is 30%, that is the earliest ultrasound can detect a fatty liver, and that is called as grade 1 fatty liver disease. 30 to 60 is grade 2 fatty livers, and more than 60% is grade 3 fatty liver. So now coming to, once you have diagnosed, what to do next? Once you have been diagnosed with fatty liver disease, uh, you need your consulting doctor will try to understand whether there are, what are the possible causes of developing fatty liver. If you are drinking too much of an alcohol, for Indian, what is the too much of alcohol? There is no safe alcohol limit as such, but if you have to drink, there are certain parameters which has been arbitrarily put up, that say that you cannot drink more than 60 ml of hard liquor uh, per day for adult males and 30 ml of hard liquor for adult female uh, in India. But these are arbitrary markers. People can develop liver injury even if they are drinking alcohol lot lesser than that. And you have to understand that no alcohol is safe alcohol, but if you have to drink safely. Don't drink more than two drinks, more than 60 ml of hard liquors in one day, and don't binge out. Suppose somebody is obese, overweight, and they drink alcohol, the effect on liver health and liver disease progression is multiplicative, not additive. So suppose somebody who is obese and also has an alcohol habit, then they are very high risk of developing liver disease. Sometimes fatty liver can be because of liver virus infection, especially hepatitis C. So some that is why if your doctor has established that you don't drink excess alcohol, the next step will be to find out other causes like hepatitis C virus infection. There are certain genetic and hereditary conditions like Wilson disease or hemochromatosis. There will be a battery of tests which will be done to establish the cause of fatty liver. Uh, Another thing which is important to assess whether fatty liver is causing any injury to your liver or not is to doing a liver function test. Liver function test is a panel of multiple parameters which will indicate whether your liver is having inflammation. So enzymes, typically alkali, ALT and AST will be elevated. You may even sometimes find mild increase in bilirubin also. Uh, but it does not give you the severity and cumulated damage over the period of time. So gold standard to detect whether how severe your fatty liver or how much damage you have accumulated so far in your life to the liver is doing liver biopsy. Liver biopsy is nothing but putting a needle through your skin into the liver and taking out small piece of your liver to examine under the microscope. That will give us an exact idea of how much liver damage has happened and how severe is the inflammation. But as you can understand, doing liver biopsy for everyone is not an easy thing, and it has got its own set of complications and risks. So nowadays the technology has advanced, and there are certain ways in through which we can estimate the amount of accumulated liver damage and severity of liver inflammation. One such modality is doing a fibroscan. Fibroscan is just like an ultrasound scan. It is done very easily without any pain or taking excess time. You need to come fasting for fibroscan for at least 3 to 4 hours, and once on an empty stomach, just like an ultrasound, one small probe will be kept around the liver area, and it will measure the hardness of your liver. So you need to understand that when there is a liver damage, when liver heals, there will be a lot of scarring. And once the scarring increases, liver, which is normally a soft sponge-like organ, will harden and become stiff and small. So with the fibroscan, we can accurately identify how much stiffness is there in the liver and what grade of stiffness, whether it is like early stage, intermediate stage, or a very advanced stage. So suppose you have identified that you have fatty liver, you have liver injury, fibroscan is showing there is accumulated damage, then you also screen for other causes of the fatty liver. I spoke to you about hepatitis C, doing workup for hemochromatosis, Wilson disease. Sometimes, but most important of all, that you have to evaluate for metabolic syndrome. Metabolic syndrome is a constellation of obesity, impaired glucose tolerance or diabetes, high blood pressure, and high cholesterol. So, in these patients, we usually do fasting blood glucose, fasting and post lunch blood glucose, HbA1c levels, fasting lipid profile. These will give us idea about their metabolic status. Sometimes fasting insulin will also be needed. Your weight and height ratios can be checked that is BMI. And depending on all these parameters, fibroscan, blood test, we can come to a conclusion that what stage of fatty liver you are, and are you at a very high risk of progression. So once we have established the diagnosis, how can we treat fatty liver? So fatty liver, the cornerstone of any fatty liver disease, like any other disease, is to address the root cause of the problem. So non-alcoholic fatty liver disease, root cause is having metabolic syndrome, which is a outcome of obesity. So reducing the weight is the cornerstone of fatty liver disease. Uh, as a thumb rule, your height in centimeters uh, uh, minus 100 should be your ideal weight. Suppose you are 153 centimeter, or your higher weight should be around 53. If you are 174, your weight should be around 74. This is a thumb rule. That is your ideal weight. Some lot of people are way overweight. More than that, they fall into obese category. Even if you don't achieve your ideal body weight, reducing the 10% of your body weight, say suppose you are 80 kgs, your ideal weight is around 60, but you may not be able to achieve the weight loss of 20 kgs to become your ideal body weight. Even then, if you lose around 10%, 8 to 10%, that is 8 kgs, around 6 to 8 kgs, you will see remarkable improvement in all the parameters related to fatty liver disease. So cornerstone of non-alcoholic fatty liver disease is weight loss. And how do you achieve this weight loss? For any weight loss, the common saying is that it is easy to lose weight, but it is very difficult to keep the weight down once you lose. So that is why going slow and steady, and not falling for any uh, attractive quick remedies. Weight loss is a gradual process, just like weight gain. You have to make small lifestyle changes which are sustainable in long run. Then only you will achieve a sustainable weight loss. So cornerstone of weight loss is dieting. As we grow old, uh, our body loses muscle after age of 30 years. So body's metabolism rate goes down, and the energy required for body to keep running also goes down. But as a creature of habit, we keep eating the same amount that we used to eat at, say, age of 20-25. So although a lot of people will say, I don't eat that much, but I'm still keeping the putting on weight. So they need to understand this concept. With age, you need to reduce your diet intake, and when you are aiming to achieve a weight loss, you should start by doing at least 25% reduction in the amount of food that you are taking. Along with amount of food, you need to understand that there are certain types of food that you need to avoid. These foods have simple sugars, and they can have immediate increase in blood sugar levels, which can get easily converted into fat and stored into the liver. So anything which is highly processed, like packaged foods, aerated drinks which have got artificial sweeteners and sugars. They usually contain high fructose corn syrup, which uh, which is directly converted into fat and stored in the liver. So avoid anything which is pre-packaged and ready-made, because they will have a lot of fat and oils. Avoid simple carbohydrates such as maida, uh, your refined atta. All these things, they will increase your blood sugar very quickly. Eat things which will have low glycemic index. What is glycemic index? Glycemic index is if you eat something, how quickly your blood sugar rises after eating it. Suppose you have glucose water, it will immediately shoot up your blood glucose within matter of minutes. But if you eat a chapati or a jonna roti, it will take much more time to absorb and increase the blood sugars. So Eat foods which will increase your sugars very slowly and gradually. Once you start losing weight with dieting, it will not only lead to fat loss, but it will also lead to muscle loss. So you have to strive to achieve a persistent muscle mass and to keep your metabolic rate going on. So initially we'll lose weight, but after a certain time, losing weight will become difficult. Why? Because you are losing your muscle, and that is decreasing your metabolism in the body, and the energy requirement is also decreasing. So you are still doing in the excess energy area. So you need to exercise also along with dieting. Exercise, recommended exercise is at least 5 days a week, 45 minutes to 1 hour per day. Doing moderate to high intensity exercise is beneficial for weight loss and as well as fatty liver. What is moderate to high intensity exercise? Moderate to high intensity exercises should be both cardiovascular as well as weight training, or what we call as resistance training. The exercise intensity should be such that you should feel out of breath when you are doing it. Just walking like that at a slow pace for hours together will not help you. You have to walk very fast uh, and briskly and continuously at a stage. The speed should be such that you may not be able to complete a sentence if you're walking. So if you do the exercise to such an extent, then only it will be beneficial. So suppose you have tried losing weight with dieting, you have done all exercises properly, and yet you are not losing weight, then there are certain medical ways which we can help you achieve your weight loss goals. One of the way of achieving weight loss medically is using certain medications like Orlistat, which are now available in the Indian market to lose weight. And patients who are diabetic, there are certain medications which will help lose weight as well as control sugars. So if you are diabetic, overweight, you have tried dieting and exercise, but you're still not losing weight, then you should discuss with your doctor what are the medical options. If medical options are also not enough, then there are certain endoscopic and surgical methods which we can use to decrease your stomach capacity and food intake. It endoscopically we can suture your stomach and decrease the stomach capacity, or can put a balloon inside so that you will feel full all the time. Excuse me. And the appetite goes down, and subsequently you lose the weight. Surgically, there are certain operations which are called as bariatric surgeries, such as sleeve or Roux and Y gastrojejunostomy or duodenal switch operation. So these are the ways we can lose the weight. Suppose you have fatty liver, but it is not alcoholic, it is because of excess alcohol intake. So it is obvious what is the treatment. Stop alcohol. After stopping alcohol, it may take anywhere between 3 to 6 months to improve the fatty liver. And if it is not because of alcohol, not because of non-alcoholic fatty liver disease, then there are, if you are identified with certain genetic conditions which lead to fatty liver, or you have hepatitis C infection, you can have specific treatments for that, and the outcomes are usually very satisfactory. So how do we one prevent fatty liver disease? So if you have gone through, listen to me through my what I have been saying so far, prevention is also easy. Prevention is not to gain excess weight, not to drink excess alcohol, and get yourself tested and your partners for hepatitis viral infection. In India, hepatitis B prevalence is almost 3 people in 100 per 100 population. So it is a very high prevalent disease in India. It spreads through infected contaminated needles and blood, and unsterile practices during surgeries, getting tattoos, or having sexual contact, and from mother to child. So please get tested for hepatitis B and C virus infection once in your lifetime. If you are hepatitis B virus negative, you have a vaccine which can help you avoid any future infection. But unfortunately, there is no vaccine for hepatitis C virus. So the precautions that you need to take to from avoid getting hepatitis C is to ensure that your sexual partner does not have hepatitis C. Uh, Always use blood from authorized blood banks, and always go to reputed hospitals where the all sterile precautions are taken. Apart from these, there is nothing special about prevention of fatty liver disease or alcoholic fatty liver disease. Is fatty liver reversible? Yes, it is reversible. If your fatty liver disease has not progressed beyond certain extent, we usually classify fatty liver disease into up to four stages: F0, 1, 2, 3, and 4. If you have anywhere between F1 to F3 fibrosis, chances are that if you uh, strictly follow the diet, exercise regimen, and medication if needed, then you may regress down to a stage lower or even completely reverse it. Uh, Unless you have progressed to stage 4, where the cirrhosis has established, there is always a chance of reversibility in fatty liver disease. So this is about in brief about fatty liver disease. If there are any questions, I will be happy to take them.